Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. So tonight I'm going to be discussing a topic mainly about ColoGuard and some of the things you may have heard about some of these new stool testings that we have for colon cancer screening. And I'm going to tell you basically what I think you should know, which is why I would always recommend getting a colonoscopy. I'll discuss tonight why I would do that. Now, as we talked about before, colon cancer currently is the second leading cause of cancer death in the United States. But the rates have been decreasing in older individuals because of the advent and the use of colonoscopy. We know that colonoscopy does save lives. We're able to find precancerous polyps and remove them at that same time. And in the past, the screening did start at the age of 50 years old, and this has been the standard for a long time, for many, many years. But as of a couple of weeks ago, the American Cancer Society did recommend for us to change the screening age from 50 years to now 45 years of age. And because of that, we're going to be having more and more people wondering about what options they have to screen for colon cancer. And the reason that change was made is because we do know that younger patients are being diagnosed more and more with colon cancer. In fact, if you were born in the 1990s, you have almost twice the risk of developing colon cancer and almost 4 times the risk of developing rectal cancer in those patients who were born in the 1960s and the 1950s. And for those people who are unfortunately diagnosed with colon cancer at an earlier age, they have a higher chance of dying from this disease because of it being more widespread and being a more aggressive disease. And so we do know that colon cancer is rising, and there are multiple different reasons why we think this is the case. We think it may be a combination of diet, and this also may be a different type of cancer in and of itself. But all in all, we're not clear as to why these patients are developing such an aggressive cancer. And so the best thing that you can do to prevent yourself from having colon cancer is to get screened. That's basically it. This is probably the most important thing you can do to prevent this disease from affecting you and the people that you love as well. Get some sort of screening test done. The benefit about the colonoscopy, which is why I recommend this, is because the colonoscopy can remove these precancerous polyps that are there. Whenever you have somebody who has a colonoscopy, you have a 61% chance of not dying from colon cancer. This is tremendous. More than half of the people who have a colonoscopy will not have colon cancer because of the fact they're getting those precancerous polyps that are removed. And the difficulty thing about these precancerous polyps is that they are not symptomatic. You could be having a precancerous polyp growing inside you and not being aware of it because of the fact that these polyps don't produce any symptoms whatsoever. And this is why we recommend getting a colonoscopy in those patients who have no symptoms, who are feeling great, who have no GI issues, because these polyps can be growing and they don't cause symptoms until it's way too late. And the best way to find them and most importantly remove them is to get the colonoscopy. This is why I would always recommend for us to get a colonoscopy. Now the question people ask me is that what about ColoGuard? And you may have seen these advertisements on TV, maybe seen some of these things in the newspaper about ColoGuard. Now ColoGuard is a little bit different than a colonoscopy. It's an at-home stool test. And the unique thing about ColoGuard is that it actually detects for stool DNA. So whenever you have a large polyp or a cancer, that polyp or cancer can shed DNA in the stool, and with ColoGuard we can detect if you have this different DNA, which may tell you you could be having these polyps or maybe even these cancers growing inside the colon. Now what the ColoGuard is good for, number one, it is good for those people who tell me I will not get a colonoscopy no matter what. I don't want one, I don't want to worry about it, I will never get one. And this is very good for those tests, for those patients who will not get any other screening done except for stool testing. And the ColoGuard is also a very good test to actually find cancer in the colon because cancer will shed a different type of DNA which we can detect in the stool. Now ColoGuard is not good for a couple different things. Number one is that it's not very good to find precancerous polyps before they become cancer. And this is why we want to do screening. We want to find these polyps before they progress onto colon cancer. So the ColoGuard is okay in terms of detecting that. But the downside about ColoGuard is that you cannot remove these polyps. If you find a precancerous polyp in the ColoGuard, we can just tell you you have a precancerous growth that's in there, but we cannot remove it. You have to undergo a second test, which is typically a colonoscopy, to remove that actual polyp that can be found in that area. Now, any positive test with a ColoGuard will need a colonoscopy, and I actually had a patient 2 weeks ago who came to me for a positive ColoGuard test. And because of that test, she had to undergo a different test, which was a colonoscopy to see if there was any precancerous polyp that was there. Also, if you undergo ColoGuard testing, you have to undergo more frequent testing every 3 years with a ColoGuard as opposed to every 10 years with a negative colonoscopy. Now with the ColoGuard, you can also have a lot of false positives and false negatives, meaning the ColoGuard will be positive, but we do the colonoscopy and nothing is found there. And this is exactly what this patient had. She had a positive ColoGuard test, we did the colonoscopy, and nothing was found on there. But more importantly, you can have false negatives as well. There are those patients who have a falsely negative ColoGuard, meaning nothing is found there, but unfortunately we end up doing a colonoscopy for a different reason, and we actually find precancerous polyps or maybe even cancer. And so this gives the assurance that with a negative test, you may not have anything going on there. And I would say this may not be the case all the time. There are plenty of cases in which you have a false negative, you have a negative ColoGuard, we end up finding something on there. But more importantly, what I found is the difficulty with insurance coverage. So number one, ColoGuard can be expensive. The cost can range from up to as high as $500 to $800 depending on your plan. Number two is that some insurance companies will not cover ColoGuard. But more importantly, when you have a positive ColoGuard test, that subsequent colonoscopy that you need will not be covered by some insurances. It goes from a screening test, which is typically covered by insurance, to a diagnostic test, which is not covered. Meaning if you have a ColoGuard done and it's positive, you have to undergo a colonoscopy. You actually may have to pay for the colonoscopy out of pocket, which is very different from getting a colonoscopy directly from your doctor. And this is one of the difficulties that a lot of patients have, is that they want to do this ColoGuard, which is a very effective test, but it comes back, they want to do this ColoGuard, which can be an effective test, but if it comes back positive, you have to undergo a colonoscopy, which is considered diagnostic, which you would have to pay out of pocket for, as opposed to getting a screening colonoscopy done when you get this ordered by your gastroenterologist. So for these reasons, I really would recommend colonoscopy, not only to find precancerous polyps, but to remove them as well. The only time I would recommend ColoGuard is if you are dead set on not getting a colonoscopy. But having said that, you have to understand that any positive test will necessitate for you to get a colonoscopy, and you may have to pay for that colonoscopy out of pocket. So in summary, the guidelines have changed from the American Cancer Society. They recommend getting a screening test done at the age of 45. And in my opinion, the colonoscopy is the best test for finding and preventing colon cancer. The data is behind us. We have seen a tremendous drop-off in the colon cancer rates since the advent of colonoscopy.